What if the most powerful thing you could do for your heart and arteries tonight costs you nothing, requires no prescription, and takes less than 15 minutes? Most seniors I speak with have never heard of it. Not because it is complicated, because nobody takes the time to explain what your body is actually doing while you sleep, and what it desperately needs you to stop doing. Tonight, I want to change that for you, completely. Because what I am about to share comes directly from the research, from cardiology and sleep medicine, and from 16 years of sitting across from patients over 60 who were doing almost everything right and still suffering. Before you get into bed tonight, you need to know what I am going to tell you, not next week, tonight. My name is Dr. Sarah Envem. I have spent 16 years working specifically in cardiovascular health and preventive medicine for adults over 60. And in that time, the single most overlooked factor I have seen, more than diet, more than medication compliance, more than exercise habits, is what my patients do with their bodies during the 8 hours they spend asleep. This is not a video about supplements. I am not selling you anything. This is about understanding the real biological processes happening inside your arteries and veins every single night, and the simple, evidence-based adjustments that can meaningfully support your cardiovascular system while you sleep. I want to say one more thing before we go further. I believe every adult over 60 deserves honest, accurate health information, not exaggerated claims designed to frighten you into clicking subscribe. What I share today is grounded in published research from peer-reviewed journals. I will tell you what the evidence actually shows, and where it shows only modest benefit, I will say so. You deserve that honesty. Here is what most people do not think about. You spend roughly 1/3 of your entire life unconscious. During those hours, your cardiovascular system does not get a break. Your heart beats 60 to 70 times per minute. Your veins are pushing blood from your legs back up to your heart against gravity. Your arteries are managing pressure and flow with no input from you at all. And after age 60, this nighttime cardiovascular work becomes significantly harder for reasons that are well understood in the medical literature. First, nitric oxide. This is the compound your body produces to keep your arterial walls relaxed, flexible, and open. Research published in the Journal of the American College of Cardiology has documented that endothelial nitric oxide production declines meaningfully as we age, particularly after 60. Stiffer vessels mean your heart works harder to push blood through. Blood moves more slowly, and slower moving blood, especially in the deep veins of your legs and pelvis, is more prone to pooling. Second, venous return. The veins in your legs rely on a combination of muscle contractions, breathing, mechanics, and the one-way valves inside the veins themselves to push blood back toward the heart. These valves weaken with age. When you are inactive and horizontal for 8 hours, venous return slows. Blood pools in the lower legs. That pooled blood is thicker, slower, and more prone to forming clots, a condition called deep vein thrombosis, or DVT. The American Heart Association data is clear. DVT incidence rises sharply after the age of 60. Third, your blood pressure at night. Most people think about their daytime blood pressure, but your nighttime blood pressure is actually a stronger predictor of cardiovascular events, according to research in the journal Hypertension. Under normal, healthy conditions, your blood pressure should drop 10 to 20% during sleep. Cardiologists call this nocturnal dipping. When it does not drop, when someone is a non-dipper, their risk of stroke, heart attack, and cardiovascular disease is measurably elevated. Research has found non-dippers have significantly higher rates of cardiovascular events compared to healthy dippers. This is not a small distinction. Now, are you waking up with puffy ankles in the morning? Do you feel stiff or foggy for the first hour after getting up? Do you take more than one bathroom trip overnight? Not because of your bladder, but because your kidneys are processing fluid that redistributed when you lay down? Type yes in the comments right now if any of that sounds familiar, because those are not random symptoms of aging. They are signs of a cardiovascular system that is not getting what it needs during sleep. I want to tell you about Margaret. She is 68, a retired librarian from Michigan. She came to me after 2 years of waking up exhausted despite sleeping 8 hours. Her ankles swelled by late afternoon every day. Her primary care doctor had told her it was just age. Her cardiologist said her heart was structurally fine. When I asked Margaret about her evening habits, she told me she watched television in a recliner until about 10 p.m. and then went straight to bed. She slept flat on her back, both legs down, all evening, all night. I explained what was happening mechanically. Gravity and reduced venous tone were allowing fluid to accumulate in her legs all evening and all night. I asked her to make 2 changes. First, elevate her legs above her heart level for 15 minutes before bed. Second, sleep with a wedge pillow to elevate her upper body about 15 to 20 degrees, combined with sleeping on her left side. 6 weeks later, Margaret told me the ankle swelling had significantly reduced. She was waking once at night instead of 3 times. Her morning fogginess was largely gone, she said. I thought this was just what 68 felt like. I did not know there was something mechanical I could actually fix. There was nothing miraculous about Margaret's improvement. It was her body responding to better conditions she had simply never been given the information to create. Before I tell you what to do, I want to show you what is working against your cardiovascular system right now, because understanding the mechanism is what makes the solution stick. Stomach sleeping. If you sleep on your stomach, your chest is compressed against the mattress for hours. This restricts your breathing mechanics and affects how fully your lungs can expand, which in turn affects the pressure dynamics that assist venous return. Sleep medicine research consistently finds stomach sleeping associated with poorer sleep quality and higher incidence of sleep apnea episodes. It also causes significant musculoskeletal strain in the neck and lower back, which disrupts sleep continuity, which has its own downstream cardiovascular effects. Disrupted sleep is not a minor issue. Research from the European Heart Journal has linked chronic poor quality sleep to increased inflammation, higher blood pressure, and elevated cardiovascular risk. Flat back sleeping. This is the most common position, and it looks neutral. But for adults over 60, it is strongly associated with sleep apnea events. When you lie flat, the soft tissues of the throat relax and partially obstruct the airway. Every time breathing is disrupted, blood oxygen levels drop, the brain triggers an arousal response, and blood pressure spikes, briefly but repeatedly, dozens or sometimes hundreds of times a night. A large body of sleep medicine research, including data from the American Academy of Sleep Medicine, links obstructive sleep apnea to significantly elevated risk of hypertension, atrial fibrillation, stroke, and coronary artery disease. And sleep apnea disproportionately affects adults over 60. Right side sleeping. This one surprises people. The issue here is partly anatomical and partly physiological. Your heart sits slightly left of center. When you sleep on your right side, some cardiac imaging research suggests that for people with certain cardiac conditions, right side sleeping may slightly increase the mechanical load on the right ventricle. Separately, your lymphatic system, your body's waste clearance network, has its primary drainage duct running along the left side. Researchers studying lymphatic clearance have found that lateral sleeping, particularly left side sleeping, may support more efficient clearance of metabolic waste from brain tissue overnight. This is an emerging area of research, and the findings are preliminary, but they are consistent enough to be worth paying attention to. So what does the evidence actually support? Left side sleeping with upper body elevation. Let me be clear about what the science shows and what it does not. Left side sleeping is strongly supported for people with acid reflux, and that matters for cardiovascular health because chronic reflux can irritate the vagus nerve, which plays a direct role in heart rate regulation. Left side sleeping is also supported for people with heart failure, where it has been shown to improve cardiac output in clinical studies. For the general senior population, the evidence for left side sleeping is real, but more modest than some online health content would have you believe. What is clear is that left side sleeping consistently outperforms back sleeping for airway patency, which directly addresses the sleep apnea mechanism I described. It also positions the aorta in alignment with its natural downward curve, reducing mechanical resistance. And it supports the lymphatic and glymphatic drainage patterns I mentioned. Upper body elevation is where the evidence becomes particularly compelling. Research published in the journal Hypertension and replicated in sleep medicine studies has found that elevating the head of the bed by 6 to 8 inches, which creates roughly a 15 to 20 degree incline, produces measurable reductions in nighttime blood pressure, improvements in airway patency during sleep, reductions in acid reflux events, and improvements in nocturnal dipping patterns. These are not marginal effects. They have been documented consistently enough that many cardiologists now recommend head-of-bed elevation as a first-line non-pharmacological intervention for non-dippers. When your upper body is elevated during sleep, venous blood pools less aggressively in the lungs and upper chest. Your heart fills and pumps with less effort. And for the venous return problem in your legs, the pooling, the swelling, the clot risk, the combination of lateral positioning and elevation creates the most mechanically favorable conditions your cardiovascular system can have during sleep. I want to tell you about Thomas. He is 72, a retired contractor from Tennessee. He came to me with a problem his cardiologist had not been able to fully solve in 2 years of medication management. His nighttime blood pressure was consistently spiking, measured by a 24-hour ambulatory monitor. His daytime numbers were acceptable. But between 2 and 4 in the morning, his systolic pressure was regularly climbing into ranges his cardiologist described as concerning. He was already on 2 medications. I asked Thomas one question: "Are you sleeping flat?" He had been his entire life. I explained nocturnal dipping, what it is, why it matters, and how head-of-bed elevation had been shown in clinical research to support healthier overnight blood pressure patterns. I recommended he raise the head of his bed using bed risers, simple wooden or plastic blocks available for under $20, and sleep on his left side with a firm pillow between his knees. At his 8-week follow-up, Thomas's ambulatory blood pressure monitor showed his average nighttime systolic had dropped by roughly 12 points. His cardiologist noted the improvement and said it was one of the better responses to a non-pharmacological intervention they had seen. Thomas told me 2 years, 2 medications, and all I needed was to raise the head of my bed. I wish someone had told me that 2 years ago. So do I, Thomas. So do I. Let me walk you through the complete setup. Every element has a specific purpose. Give each one its due. Element 1, upper body elevation. Your entire upper body, from below your shoulders upward, should be elevated 15 to 20 degrees. This is not just stacking pillows behind your head. That creates neck compression, not true elevation. Your options are a foam wedge pillow that supports from mid-back to head, or bed risers placed under the feet of your bed frame at the head end. Bed risers are inexpensive, $20 to $40, and hold their angle reliably all night. The head of your bed should sit approximately 6 to 9 inches higher than the foot. Do not exceed 25 degrees, or you will slide during sleep and create lower back strain. Element 2, left side position. With your upper body elevated, position yourself on your left side. This aligns your aorta with its natural curve, supports your lymphatic drainage direction, and keeps your airway in its most open orientation. Element 3, knee pillow. Place a firm pillow between your knees. This keeps your pelvis in a neutral stacked position. Without it, your upper leg rotates forward and downward during the night, which places torsional stress on your lower back and pelvis and can compress the femoral vessels, the major blood vessels through your upper thigh. Keeping your hips stacked keeps those vessels uncompressed all night. Element 4, rib cage support. A rolled towel or small firm pillow placed under your left side just below the armpit prevents you from rolling onto your back during the night. This small support takes pressure off your left shoulder and maintains your left side position without you having to consciously hold it. Element 5, head pillow. Height. Your head pillow must keep your neck in a straight, neutral line from skull to tailbone, not tilted up, not angled down, neutral. This is important because excessive head elevation. Stacking 2 thick pillows on top of a wedge, for example, can partially compress the carotid arteries over hours. Test your position. If your neck is angled upward or your chin is tucking toward your chest, your pillow is the wrong height. One medium firmness pillow is usually correct for most adults on a wedge. Now, I want to share the element that ties everything together, and this one is supported by robust vascular research. Throughout the day, especially if you have been sitting for long periods, fluid accumulates in your lower legs and feet. By the time you go to bed, your legs are carrying a significant fluid load. When you lie down, that fluid redistributes rapidly toward your core and kidneys. Your kidneys respond by producing urine, which is why so many adults over 60 make 2 or 3 bathroom trips overnight. In many cases, this is not a primary bladder problem. It is a fluid redistribution problem that the kidneys are resolving at 2 in the morning. The research-backed solution: elevate your legs above heart level for 15 minutes before bed. Lie on your back with your legs propped on pillows, the arm of a sofa, or against a wall. This uses gravity to drain pooled venous blood back toward your heart and kidneys before you sleep. So the redistribution happens while you are awake and in control, not at 2 a.m. Research in vascular medicine consistently supports leg elevation as an effective intervention for reducing peripheral edema and improving venous return in adults with venous insufficiency, one of the most common and undertreated conditions in people over 60. When combined with compression stockings during the day, the overnight elevation protocol has been shown in clinical literature to produce measurable reductions in morning leg swelling and overnight bathroom frequency. This is not exotic medicine. It is gravity, applied deliberately, consistently. I want to tell you about Dorothy. She is 74, a retired nurse from Ohio, which made her particularly frustrated that nobody had told her what I was about to explain. Dorothy had been waking up 3 or 4 times a night for 2 years. Her urologist had evaluated her. Her gynecologist had evaluated her. Both had concluded her bladder was within normal range for her age. She had been told to limit fluids after 6 p.m., which she did religiously, and still woke up 3 times a night. When I asked about her day, she described spending most of the afternoon sitting watching television or reading with her legs dependent, feet on the floor. By evening, her ankles were visibly swollen. She went to bed around 10 p.m. with legs that had been accumulating fluid all day. I explained the fluid redistribution mechanism. I asked her to elevate her legs for 15 to 20 minutes every evening before bed, just against the sofa arm with pillows, and to begin the sleep positioning protocol. 5 weeks later, she came in looking considerably more rested. Her overnight bathroom trips had dropped from 3 to 4 per night to 1, occasionally none. Her morning ankle swelling was dramatically reduced. She said, 40 years as a nurse, and I never connected those dots. I told her the education system in medicine has not always connected them either. That is why this conversation matters. Before I give you your action plan, I want to cover the 3 mistakes I see most consistently in patients who start this protocol and do not get the results they should. Mistake 1, using standard pillows for elevation instead of a wedge or bed risers. Pillows compress. You start the night elevated and wake up flat with disrupted sleep on top of no benefit. A foam wedge or bed risers hold their angle reliably all night. It is a one-time investment of $30 to $70 that will last years. Mistake 2, elevating only the head. Stacking pillows behind your head while your torso stays flat creates neck compression, not true upper body elevation. You feel like you are doing the right thing, so you stop investigating why it is not working. Your entire torso from below the shoulders up must be elevated. Mistake 3, implementing every element at once after decades of different sleeping habits. Your body has muscle memory. Introducing 5 new positional elements in one night often means waking up multiple times and abandoning the whole thing by morning. Introduce 1 element every 2 to 3 nights. Within 2 weeks, everything feels natural, and you are receiving the full benefit. Tonight, 3 things. Sleep on your left side. Put a pillow between your knees. Spend 15 minutes with your legs elevated before bed. Sofa arm, wall, pillows, any version counts. This week, order a foam wedge pillow or a set of bed risers. Both are available online or at any large pharmacy for $30 to $70, less than a single specialist copay. Once your equipment arrives, implement the full setup. Left side, 15 to 20 degree upper body, elevation, knee pillow, rib cage support, neutral height head pillow, pre-sleep leg elevation every night. Track 4 things each morning: ankle swelling, mental clarity when you wake, number of overnight bathroom trips, and how long it takes you to feel awake. Give it 30 days. Come back to this video in the comments and tell me what changed. I will be reading every single one. I want to say something to you directly before you go. If you have been told that fatigue, swollen ankles, poor sleep, or palpitations are simply part of getting older, I want you to hold that statement a little more loosely than you have been. Some of what we accept as inevitable is mechanical, and mechanical problems have mechanical solutions. I am not telling you that changing your sleep position will reverse arterial disease or eliminate your need for medication. I would never overstate what the evidence supports. What I am telling you is this: your cardiovascular system is working hard right now, every single night, with or without your awareness. And the conditions you give it to work in matter. They are measurable, documented, and within your control. Left side, elevated upper body, knee pillow, legs drained before bed, 4 elements, 1 month. That is the commitment. Your body has not given up on you. It is working right now with everything it has. Give it the conditions it needs to do that work well. If this video gave you something useful, something grounded and honest that your doctor may not have taken the time to explain, I have one request: share it. Think of one person in your life who wakes up exhausted, whose ankles swell, who takes blood pressure medication, who has had a scare. One click puts this information in front of them. If you are new here, subscribe. Every week, I bring you evidence-based cardiovascular health information designed specifically for adults over 60. Practical, honest, and grounded in what the research actually shows, not what sells. Before you go, leave a comment. Which position have you been sleeping in? What are you going to change tonight? I read every comment personally because every person watching this matters to me, not as a viewer, as a patient. Sleep well tonight.